Hello, it's Randi Rhodes. Here's a clip from our show, and go to randyrhodes.com for the whole thing and a podcast. Buy a stinking podcast.
Mary had a little lamb.
The fault. We believe that all men are created equal.
To the magnificent mosaic that is America.
From radio beacon to radio beacon. I have a dream today. Change has come to America.
Believe me.
Knock, knock. Who's there?
It's a figment of your imagination.
Randi Rhodes Show. Turn up your
All right, I just thought I would show you something so that we can all understand how important it is to actually participate, yes, in our own democracy and vote, especially if you're in a Super Tuesday state tomorrow, okay? Because this president, who knows all the best people, who has had like 78% turnover in his administration, I think we're on like the 6th Homeland Security advisor, the 19th, Secretary of Defense, everybody's acting. We don't have, this is our new Health and Human Services Secretary, Chad. Everybody meet Chad. This is Chad being questioned by the devout Republican from Alabama, John Kennedy, Senator Kennedy, asking Chad, our acting Health and Human Services Secretary, in the middle of a COVID-19 pandemic, and it is, 6 people have died in the United States. We have cases in all over this country now. You've got young people succumbing. We have a 20-year-old, was that Florida, Scott? A 20-year-old in Florida died. Diagnosed. Oh, I thought you said died. So anyway, we have this this unbelievable situation, and here is the response of Health and Human Services Acting Secretary Chad.
Do we have enough respirators?
To my knowledge, we do. I'm focused on making sure that our operators at DHS make sure that they have the protective equipment. I know HHS, as part of the supplemental.
Well, we just heard testimony that we don't.
Testimony from?
In a briefing.
Okay.
So you're head of Homeland
For medical professionals or for sorry, I don't understand the question.
You're head of Homeland Security. Do we have enough respirators or not?
For patients, I don't understand the question.
For everybody, every American who needs one, who gets the disease.
Again, I would refer you to HHS on that.
Mr. Secretary,
my budget supports.
You're supposed to keep us safe.
My budget supports the men and women
You're
of the Department of Homeland Security.
You're the Secretary of Homeland Security.
Yes, sir.
And you can't tell me if we have enough respirators.
What I would tell you is that the budget, my budget, our operations are focused not only on the men and women of DHS, making sure they're protected to do their jobs, to screen individuals coming in. We're working with HHS, CDC, and their budgets
don't know the answer, do you?
to ensure that they have enough medical equipment.
Do we have enough face masks?
We, for the Department of Homeland Security, we do.
I'm not asking for the Department of Homeland Security.
Are you looking?
I'm asking for the American people.
For the entire American public?
Yes.
No, I would say probably not.
Okay. How short are we?
I don't have that number offhand, Senator. I will get that for you.
Okay. But I want to be sure I understand. Somebody
Yes, sir.
is doing modeling
Yes, sir.
on how many cases we're anticipating. You're
Yes,
just
sir.
not aware of them.
You're asking me a number of medical questions that
I'm asking you
CDC
questions
and
because you're
HHS
Secretary of
are
the
focusing
Department
on.
of Homeland Security. And you're supposed to keep us safe.
Yes, sir.
And you need to know the answers to these questions.
And
How far away are we from getting a vaccine?
in several months.
Well, that's not what we just heard testimony about.
Okay.
Who's on first here?
HHS is
What's
the
on
lead
second?
federal agency for the coronavirus response.
You're telling me we're months away from having a vaccine. That's your testimony as Secretary of Homeland Security.
What I have been told by HHS and CDC, yes.
And have you probed that to make sure that's accurate?
Yes. We continue every day. We have task force meetings with those individuals and elsewhere talking about a number of these
Well, your
issues.
numbers aren't the same as CDC's.
Then I would certainly defer to CDC on our medical questions.
Well, don't you think you ought to contact them and find out whether you're right or they're right?
We're in contact with them every day on our task force.
But you don't know why
planning
you have
for
a
them.
discrepancy.
I would refer you to the CDC on
Mr.
specific
Secretary,
questions.
I'm going to hush here. You're supposed to keep us safe, and the American people
Senator,
deserve some straight answers on the coronavirus. And
Senator,
I'm not getting them from you.
I disagree.
That's all I have, Madam Chair.
We're in great hands. Chad's got this. Chad with his little scruffy beard there and his perfectly parted salon hair. I feel so, Chad reminds me of, American Psycho. That is just, that's whose hands I believe we are in. American Psycho. All it's missing from Chad's testimony is Phil Collins playing in the background. That's all that's missing. This is a studio. I mean, if I could play music, I would have played that clip over Phil Collins' music. There's no question. This is so bad. And here Pence is on Fox News. This is Mike Pence over this weekend trying to spin his failure into some sort of a victory. I just want you to know that the most basic thing that doctors need in order to understand who has this virus and what to do about them being released from hospital is a test kit. A test kit.
I mean, was the president upset that we couldn't do accurate testing initially? South Korea has testing from your car, your drive-through testing. China says you can test from home. We haven't done the testing.
Well, we've done a fair amount of testing.
500 tests?
But we've actually screened 47,000 people coming through designated airports in the country and done testing at airports. But the new challenges that we have is we want to make testing kits available to local healthcare providers so that if someone presents with a respiratory illness, that they'll not only be tested for the flu, but they'll also be tested for the coronavirus.
He wants to make them available. We have known about this since, December? Here's Dr. Matt McCarthy. He's just a doctor who helps patients who, get sick because he's a doctor.
The CDC created a test,
messed up a reagent,
sent a test out to 50 states, and then said, "Oh, hold up, don't use it. Let us fix it."
How quickly
it's
can
now
we get
March.
on track now, Matt?
We hear that it's coming very soon, but I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. I still have to call the Department of Health. I still have to make my case plead to test people. This is not good. We know that there are 88 cases in the United States. There are going to be hundreds by middle of the week. There's going to be thousands by next week.
So
and this is a testing issue.
What do you do with people in the emergency room if you can't test them?
Well, we call and we try to test. We isolate them. We have an outstanding team of infection control practitioners who know how to handle this, but they're hamstrung by the fact that we don't have a diagnostic test available.
Are people getting sent home? Because I read reports of that over the weekend.
We're not sending people home. We're making sure they get what supportive care we can give. But keep in mind, we now have this in New York State, right? The person who tested positive was only the 32nd test we've done in this state.
Oh, my God.
That is a national scandal. They're testing 10,000 a day in some countries, and we can't get this off the ground. I'm a practitioner on the firing line, and I don't have the tools to properly care for patients today.
That is a reality. That's true stuff. That's a doctor who has absolutely no dog in this fight except to help his patients. And you know why? You know why there's no testing? Because they don't want to know. Donald Trump doesn't want the numbers. He doesn't want anybody to know what a failure he has been. He doesn't want people tested. He wants to say during this campaign that they died of other things. They died of the flu. They died of, anything but coronavirus. Anything at all but coronavirus. Well, they were sick anyway. Over the weekend, he gave a press conference, okay? And he said that he felt really bad for this woman who succumbed to coronavirus. You know what the problem with that was? She's a man. He doesn't even know who, where, what, or why. Go to RandiRhodes.com for the whole thing and a podcast. Buy a stinking podcast.